What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we'll cover how hard is it to make a CD or to transfer the exam to a different hospital or to make a CD. Okay, so both are in similar realms. To give you context, I am night shift X-ray tech, so it's not really that hard to make cassettes or even to push it to different hospitals if they're in your network. Usually, just to make CDs, you'll go into your local packs, you'll get your CDs or whatever you have, and then you'll right click the patient, and then it'll say export to media, and then it'll let you pick how many. The only situation is if you're doing basic X-rays, you can run it under a basic CD. But if you're doing CAT scan, you'll have to have something like a DVD one with like more gigabytes, because CAT scan takes a lot of room as far as the data wise, so you'll need a different kind of disk. You can't run it on the same one. So that's something to keep in mind. And the difference between how the time it takes to burn a disk, like a regular X-ray, you can burn that in like about a minute tops. Versus a CAT scan one, it can take like between 2 all the way. I've had one patient that had like 10 CAT scans in it. It could take like 10 minutes to get burned. Also, I guess depending how like bad your equipment is, it could take longer, or how fast your network. It like varies stuff, but that's kind of a given. But that's not that bad. And usually, you'll make the disc, you write it with a Sharpie or whatever, the patient's name on it, and then you'll turn it into the front desk or whoever. So as far as pushing it to a different department, like a different hospital that's in your network, usually you'll hit export to destination, and then you'll get a generation list. They'll say so and so, so and so, so and so, and then you're like, okay, I wanted to send it this, or this to this, and then you'll send off. Usually, you got to make sure there's a report already read, because if you send it before the report, and then you try to send it again, it's kind of hard. So always make sure that there's a report with your exam, so you know. Okay. And usually when you have to make CDs, is usually if the patient's being flown out, or if it's like a kid, or if it's like a trauma. Usually those are the top reasons that you would have to either make a CD or push it off, or if the patient requests it, because they're usually at a different hospital. Usually, if the patient already goes to your hospital to see their PCPs or whatever, and they're already in the system, usually they won't ask for that. So that's kind of a context of what you can expect. And yes, been your boy Miguel. See you on the next one.